A disability is something that has a major impact on your life.
Every disability is different.
And it's never the same thing for two people. I am blind in my right eye totally and partially sighted in my left eye.
I was 18 years old. We were traveling way too fast on a gravel road. Broke my neck, my back.
My Asperger's syndrome and my cerebral palsy.
I have anxiety and depression. People would have no idea just talking to me.
Being independent means different things to different people.
I want to live in my own house. I want to pay my own bills.
Live independently and not rely on other people.
When someone is not able to live as independently as they can, it does have a detrimental effect on people's physical and mental well-being.
It's no complicated thing. It's just that people with disabilities want to be included.
Plenty of people get stuck in ruts when they feel like they can't overcome something in their life. That's where LIFTT comes in.
Living independently for today and tomorrow. LIFTT. We help people of all ages and all types of disabilities find the resources or acquire the skills to live as independently as possible.
We serve the southeastern 18 counties here at the Billings office. We have a variety of things that we offer. We can help with grant funding for adaptive equipment.
Maybe a home modification so they're able to access their home. We help people to find that funding.
Helping people apply for Social Security benefits.
Medicaid, Medicare, housing.
They have a peer support group. Peer support, I think, is key.
Sharing life experiences is one of the most powerful things to help people who might be new to disability, who might be struggling with their disability.
Youth transitions is kids that are transitioning out of high school. They need to learn those adulting skills. It might be rent an apartment, learn how to grocery shop, budgeting.
Help someone advocate for themselves in a school or an employment setting. One of our biggest strengths is providing folks with information and referral. If we can't help you, we hope to know who can.
A lot of times we'll have a potential consumer call in and they think that they just have one need, and it turns out that we end up finding 3 or 4 things we can actually do for them.
You can just come in and say, hey, I feel like I have this going on. Can you help me? And we can, which is so cool to me. I love that.
Most of us on staff at LIFTT have identified ourselves as having one or more disabilities. That is helpful in many cases.
It's easier to empathize with someone when you yourself have struggled with a disability.
This is what we specialize in. This is who we are, and this is what we do.
And it costs nothing to go to LIFTT. It's a nonprofit organization and they're there to help.
Somebody that was a consumer that was working with LIFTT was asked to do an art project. He visualized that the balloon helps to lift people up. And then it became the logo, and it's stuck.
There's been success on all kinds of levels.
It's really rewarding to have a consumer go, hey, I was able to do this by myself today.
We want people to live their best life as independent as possible.
Live as everyone else in society and live as a part of society, not apart from society.
Everybody needs help. Sometimes you just need a little more help, and that's okay. That's absolutely okay.
There's plenty of life to live still, and there's a way you can do it. Keep chipping away at it, little by little by little.
Knowledge is power. Let's share it, for crying out loud.
Send us an email, give us a call. We'll do our best to help.
We can definitely help figure out what your needs are and get started on that. We're one of many steps in the path to independence, and we're happy to be serving people here in the community.
Good day and welcome to Living Well in Montana. Living Well in Montana is a program of living independently for today and tomorrow, LIFTT, L-I-F-T-T, as we like to call ourselves. LIFTT is what is known as a Center for Independent Living. We are a place for advocacy and resources for persons of all ages with all types of disabilities across an 18-county service area in southeastern and south central Montana. For more about LIFTT and our services, I encourage you to visit our website at liftt.org, or coming soon, we will have our mobile app back up and running on the Apple App Store and the Google Play for your Android devices, so you can look for us there. That's where you find us if you want to learn more about LIFTT. Today on Living Well in Montana, we will be focusing on LIFTT's future. Again, over the past, I've worked at LIFTT for 15 years, coming up in April, and over the past 15 years or so, I have seen many changes, many successes, a few failures, but certainly in the last 5 years since our guest today, Carlos Ramalho, our executive director, came aboard, we have seen a period of unprecedented growth and change in how LIFTT does things. This has been noticed, and Carlos will speak more to this. This has been noticed not only locally, but regionally and nationally. And to build on that success of the 5 years that Carlos has been with us, Carlos and the board of directors and other key stakeholders have developed a 5-year strategic plan for the next 5 years of LIFTT's future. And that's what we'll be talking about today. Carlos, if we can start with, thanks for being here. And if we can start with the key themes of the strategic plan, which are service leadership, quality, and innovation. What does that mean?
Well, those are the pillars on which our vision for the future of our organization are standing. Leadership service, we need to be present in our service area, identify the needs of the aging and disabled population that we are here to serve, and engage them either directly or in partnership with other organizations. The second pillar is quality. We are going to improve the quality of the services we provide. I would say that the quality is already outstanding. We provide not only independent living services like information and referral, elderly and youth transition services, advocacy, but we also provide the personal care assistant services through the Self-Direct program. All those services are quality services and they meet the needs of our consumers, but there are always changes and opportunities for improvement. For example, we responded successfully to the EVV, electronic verification app or electronic way of being held accountable by the authorities.
And that was in the Self-Direct program.
Self-Direct program. And the third pillar is innovation. As you said, the last 5 years have been characterized by constant change. We are always thinking about what is being done the old way? How can we do it differently? How can we improve? How can we bring positive changes to the way we do old things? So I would say that change has been a mark of LIFTT's daily operations in the last 5 years, and it will be the constant mark of the next 5 years until 2029. The strategic plan that was approved by the Board of Directors in August 2024 and entered into force in January 1st, 2025, is valid until 2029. In 2029, we will sit and reevaluate, like you said, the successes and failures. I don't like to refer to mistakes as failures. I prefer to refer to them as opportunities for transformation.
Fair enough. One of the most immediate changes, and you can speak to this, has been a slight change in the wording of our mission and vision statement that was just approved by the Board of Directors.
That's part of implementing the strategic plan. So in the first meeting of the Board of Directors in January 9, the board amended our vision and mission statement. Up to January, our vision and mission statements stated that we are here to empower people living with disabilities. Starting in January 2025, part of the enforcement of the new strategic partner, we are here to empower the aging and disabled individuals in our service area. Just because aging and disability are the intersection of a very important moment in the life of any human being who starts to deal with limitations and restrictions that prevent them from completing a task that for others who are not aging and do not have a disability, it's done easier. So LIFTT is here to support, to empower, to make the lives of the people who are aging and living with disabilities easier.
Okay. So that's a small, but it's a pretty significant change because, again, I mean, we're used to talking about all ages and all disabilities, and that still holds, obviously, right?
Correct.
And but to specify the aging community, particularly in southeastern and south central Montana, where our population is, even as it grows slightly, is definitely aging, is important. And can you speak to some of the work we've begun partnering with certain organizations?
One of the reasons that we decided to go in that direction is because of the expectations of both the state and federal partners we work with. Individuals sometimes are reluctant in identifying themselves as disabled, but they are not reluctant in identifying themselves as aging. They are reluctant in qualifying themselves as disabled because there is still a stigma attached to that adjective. But they acknowledge that with age, they become slower, they become more vulnerable to diseases and physical conditions that restrict and even limit their movement and their ability to work, to study, to do things at home. Okay. So we are also trying to diversify and promote inclusion by adding the term aging to our vision and mission statements. Not to mention that we've been engaging aging and disabled individuals in our service area alike. And we've been establishing and working hand in hand with organizations like Action Eastern Montana, Adult Resource Alliance. In December, for example, we established a formal partnership with Area 2 Aging Agency, headquartered in Roundup, Muscle County, which belongs to our service area. So we want to form a bigger community, amplify our scope of work within our community.
You mentioned earlier that the strategic plan for LIFTT dovetails to and helps LIFTT be in compliance with a larger plan. I believe it's called the statewide plan for independent living. Can you talk a little bit about the interplay there?
As you know, from time to time, the 4 centers for independent living who are under the jurisdiction of the statewide Independent Living Council, together with other organizations, including the organizations that provide services to the aging population and the Department of Public Health and Human Services, they write the state plan for independent living, which is a piece of policy. It can be considered legislation in the strict term of the definition, but it's written not by the people or the Montana legislator. It is written by the stakeholders who are, I would say, a bridge between the people in need and the resources they need to live independently. This document establishes priorities and strategies that we need to follow. And the strategic plan aligns LIFTT's actions and plans for the future with the SPIL, the statewide plan for independent living. I would say that in order to write the strategic plan, we had to understand what the SPIL expected from us and move LIFTT in that direction, because it requires actions like aggressive outreach. As you know, our service area is huge, 18 counties. It takes 8 hours to drive from the west corner of our service area to the east corner. It fits probably 40 states of Rhode Island in our service area. It's a huge...
If our service area was a state, it would be on the list between Pennsylvania and Mississippi in terms of size.
That's how big it is. And the expectations and the needs are also very expressive. So in order to approach those needs and expectations and correspond to them and meet them, we needed to have a map, which is the subject of our conversation today.
And if I may try to further that analogy, the sort of the compass of this map is our organizational values, including integrity, community service, accountability, collaboration, and engagement. And maybe you can elaborate a little on what those mean, or?
Well, when we establish in the past, when we established a partnership with any organization, it was simply verbal. We met, we shook hands, we had a conversation, we identified goals and purposes of our organizations, and we agreed to work together. Now, under the new strategic partner, we are moving above and beyond, and every partnership is now being established formally through the signature of a memorandum of understanding, defining and describing the two organizations, LIFTT on one side, the other organization on the other, their goals, their purposes, the territory, and how they can work together to benefit the community, the population, and the individuals we serve. So that's one of the innovative ways of establishing those partnerships. We believe that by establishing partnerships with a memorandum of understanding, which is equivalent to a formal contract, the partnerships tend to be more permanent. For example, during COVID, we established formal partnerships with the 18 health county departments, and these memorandum of understandings signed 2 years ago are still in force. We are still working together to keep the population safe and educated about the risks of the pandemic, COVID, and other crises that might happen in the future. So that's the vision for the next 5 years.
Okay. The plan talks in several places about sort of strengths, weaknesses, opportunities, and threats.
Yeah, that's called our SWOT. When we wrote the strategic plan, we had to take all that into consideration. And we started with our strengths. You know, LIFTT's biggest strength is the dedicated team that we have working at LIFTT. Not only independent living specialists who study and go through constant training and continuing education, but they have a endless curiosity about identifying and find solutions for the consumers that they serve. So the board of directors and our leadership recognize that our biggest strength is our dedicated team of independent living specialists, PCA facilitators, and administrative staff. We could not operate if we didn't have a state-of-the-art financial department, for example. A person like Deborah, our finance director, who is capable of following and managing our budgets and not spending a dollar above of what we can. We also have new programs and new staff like the diabetes prevention program. We have two nutritional health coaches, and we have Emily in the kitchen preparing the most amazing meals for the people participating in the diabetes prevention program and our employees. And we have the people in charge of the outreach, doing community engagement in a way that they work as ambassadors of LIFTT and independent living. So that is our bigger strength. We also have a list of comprehensive services. We provide not only information and referral, advocacy, youth and elderly transitions, but we also provide home and vehicle modification. We walk with the consumers in need of public services or social security services, and you are one of the leaders in providing that type of service to our community. So even if we don't know what we can offer as specific individual, we will research and we will find solutions and alternatives that will meet their needs.
Yeah.
So that's another strength.
Yeah. So
We also have strong partners in the community, and we are trying not only to draw strength from them, but we are dedicated to providing them with what will make them stronger as well. Of course, we have weaknesses, and one of our weaknesses, I would say, is the lack of funding. Sometimes we wish we would have more money to do everything that we need. For example, April will be a year that we are occupying our new building on Crawford Drive. And we still have not been able to raise money to install an elevator in the building, which prevents people from working on the offices upstairs if they have any mobility issues. It doesn't mean that we are not working on looking for that type of funding. It means that we have not yet found a grantor willing to sponsor that initiative.
Yep. Got about a minute or so left here. What is your hope if you and I are still at this in 2029 and we sit back down here? And what do you hope to have accomplished? Yes.
I hope that we will still be on board in 2029 and we'll be able to sit together and tell our audience that we have delivered the amazing, not only the amazing services, but to an amazing people that endure undescribable difficulties every day to live independently, but they accomplish what we are here to help them. And you, better than I, know that a person with disabilities, an aging individual, will succeed as long as we provide them with the accommodations and the services that they need. They will succeed and they will live independently and make society proud of them.
Thank you, Carlos. Again, for more information about LIFTT and what's going on at LIFTT, please visit our website, LIFTT.org, or you can give us a call in Billings at 406-259-5181 or in Glendive at 406-948-8500. Thank you and good day.